Good day, my name is Kip Marso B. Batingana. I am your student nurse for today and I will be performing ambulation. So, first step is to review medical record for patient, most recent activity experience, and record weight. So this is for us to know if the current state or the current weight of our patient and for us to know if our patient has already done his activity for today. Then, next is to review medical record for history risk of orthostatic hypotension. We do this in order for us to know if our patient is capable enough to do such activities for our today's activities. Then next is to review healthcare provider's order for activity, notes mobility, or weight-bearing restrictions. It's for us to know if what is the order of our doctor to our patient. Then we check our chart. So name is Gandya. Our patient's current weight is around 57 kilos and no hypotension has been indicated. Then doctor's order is for ambulation, assistive ambulation once a day. Then next is to determine the best time to ambulate, schedule around other activities. So according to our patient's chart, the ambulation for each day is after 1 hour after breakfast. This is the best time for our patient to do such activity because after the breakfast it gives him energy to do the activities and can rest for the rest of the day after the activity. Then next is to check the patient's environment for barriers or safety risk. This is done in order for the safety of our patient during the activity. So, as we assess the area, there are no such barrier risk. The next is to identify patient using at least 2 identifiers. This is for us to know if the patient that we are going to ambulate is the correct patient. So, name, sa'yo pangalan mo, sir?
Kessler Cardia.
Birthday, sir?
June 3,
Okay, sir. So,
29 years.
then, next is to perform hand hygiene. We perform hand hygiene in order to avoid contaminating our patient and to deter the spread of microorganisms. So, hand hygiene. Then, the next thing we need to do is to assess patient's readiness to ambulate. By assessing this, first is to assess the baseline vitals or vital signs. The next is to assess ROM and muscle strength to lower extremities in bed if necessary. Then as the patient is tired or experiencing pain, determine source and severity of pain, administer analgesic if necessary. So, sir, follow vital signs, sir.
Wow, like that. There you go.
Ito yung best size.
After we take the vital signs, we assess sa our patient's leg. So, sir, pwede malihok na may mong left leg, sir.
Oo.
At sa right leg, sir.
Right leg ulit kali.
Okay. So, ato na siyang bilawon, sir. O, bilaw na siya, sir, no? Nasa pikas, sir. Ingon lang ako sakit, sir. Sige, sir. Then, matuyok na may mukhang tail, sir, sa left.
Dali ana.
Ana.
Okay.
Sa right, sir. Sige daw, sir.
Dito sakit kamay.
May sakit gamay. So, then, after that is, after we check the patient is to assess the patient's level of response to commands, views regarding health, and willingness to participate in activity. So, sir, malungog mo kanimo maayo, sir, no? So, karon sir, kayo mag-ambulate ta karon sir, kay mo may naka sa patients ay sa doctor's order, sir. So ang ako lang, sir, is nila ako sa command, sir. Okay naman sa mga sir na magbuhat ako ng activity, sir. Okay. Then, the next is to assess patient for any deficit that may affect his or her ability to follow instruction. So, the next is to place chair or wheelchair nearby if necessary. This is for us during the activity, we can transfer our patient here if something happens. Then, next is to explain to patient how to prepare for ambulation, explain benefits and reasons for activity, consider patient's beliefs and values regarding health. So sir, kanya activity na to siya, sir, is para ni siya sa imong sariling kamayuhan, sir. Yung kamayuhan, sir, para slow progress nito, sir, para pagkadugan, sir, kay makabalik nagwaktas, sir. So karon, sir, kay determinado yung kay kana mo pan-cron, sir, mo sabay sa atong activity, sir.
Okay. Kaya ko mag-play.
Sige, sir, maayo, sir. And next is to assist patient from a supine position to side to bed. Then, raises head of bed placed in low position, places non-skid footwear on patient, stands on appropriate side of bed, turns patient into the side facing self. Then ang katong purpose din sa atong non-skid is for during ambulation is that dili siya slide while gawak atong patient. Then stand appropriate side of bed, turn the patient into the side facing self for sa preparation. Then stand opposite patient, hips turn to face patient and for corner of bed. Then places feet in wide base of support. That is for the center of gravity for our balance. Then place arm properly under the patient's shoulder. Places the other arm around the patient's thigh. Then after that is to move patient's legs and feet over side of the bed, pivot weight to allow patient's upper legs to swing down, elevate patient's trunk to upright position. Para atong patient this is for our patient to be positioned in a sitting position to ready for ambulation. So sir, sir, pasahin to sir. Then pivot feet, left hand the shoulder, then right hand on the thigh. Then instruct your patient if when you do the pivot turn. So sir, tuyo akong asahan ng shoulder, sir, mong tiil, kay birahon ako, sir, para makalingkod ka, sir, sa command, sir, on 3, sir, ha? Okay, 1, 2, 3. Okay, very good, sir. Then, steady lang, sir, ha? Then, allow patient to sit for several minutes, flexes and extend patient's feet, and moves leg up and down, check blood pressure if necessary, have patient to relax and breathe if he or she feels dizzy, and return patient to bed if necessary. So sir, nalipong ka karon, sir?
Wala man.
Wala. So sir, i-assess lang natin yung tail sir. Ano na may mo left leg sir? Sige daw sir. Sa right leg sir, baka rin makaya sir.
Iya, dala.
Dira lang. Then matuyok na to atong ano sir, tail. Sa right leg sir, kung makaya lang. Kaya. Okay sir. Then after that is apply gait belt appropriately. Holds belt properly once patient stands. So sir, pag-apply taning gait belt sir, kani siya na gait belt sir is for assistive device ni sir para sa tanggabaktas ka sir kay ma-assistan ti ka sir. Tawag na sir, itaas ang kamot sir. Tama lang ka, buhok sir.
Luwag pagkamay.
Hello, pag umay pa rin sir. Kana sir.
Okay na.
Okay. Then, after we apply the belt, help patient to standing position with shoulders back, assess ability to bear weight and balance. Yeah. Returns patient to bed chair immediately if he or she is unsteady, obtains additional help. So this is the purpose of our chair. If our patient cannot do the activity, we can directly transfer him in the chair or into the bed. Then, okay. So I will now perform. So sir, mutindog na ta karon sir ha. I-assist ka karon ginita na ko yung gate belt tapos on 3 sir tindog ta sir.
Sige.
Sige. On 3. Ay buta yung kamot sa likod sir. Sa shoulder na. On 3, 1, 2, 3. Yan na sir ha. Then, place IV pole on side of infusion. Instruct patient to push pole while walking. So, balik sa lingkod sir. So, assuming that this is our IV pole. So sir, dire ka magunit niya sir. Well, gabaktas ko sir. Assist mo siya sir. Yes sir. Yes sir. Ayun ka sir. 3, 1, 2, 3. Yes. Sir, gunit ka din sa yung IV pole sir. Sige. The next is to empty drainage bag if necessary. Ensure bag is carried appropriately and there is no tension on tubing. So, wala may tension sa tubing sir, sa mga IV sir, no?
Wala.
Laman. Then, decide with patient how far to ambulate. So sir, ang ato ang ambulation, ang ato ang baktason karon sir, is tamon dito sa side rail sir. Makapaminan mo sir, makain mo sir.
Okay.
Kaya. Sige. Then, isa, stand on appropriate side of patient and slightly behind. Grasp the gait belt, support patient appropriately through first few steps. Then assess strength and balance before continuing. So sir, baktas na sir. So, kuhan sir, kaning mga 2 steps lang sir, 3. Sige sir, nahinay lang sir ha. 1, 2, easier. 2. Okay. So, kuminan mo sir, kaya pa sir?
Okay, man.
Kaya pa. Then, assess the strength and balance before continuing. Position patient between self and wall. Encourage use handrail. Observe how the patient walks. Evaluate activity tolerance. Yes sir, baktas sir. Padulong tayo dito sa side rail sir. Yes sir. Araw ko dito sir, support lang ko. Sir. Kamera dito. Okay. Yan. So sir, gunit tayo dito sa handrail sir, samtang para kuhan sir, kana ikaw na isa sir, kana. Sige daw sir, baktas daw sir. Kaya ba? So sir, babalik ta padulong dito sa bed sir.
Bulita nurse.
Sige lang, kaya na sir. Nama ko sa likod sir. Assess mo ko. Okay. Then, react if patient starts to fall. Then, if the patient, in this scenario now, we will perform if the patient is, starting to fall. So, grasp the gait belt with both hands for support. Dapat nakalak yun siya. Then, stand with feet apart for support. Like same rationale for the center of gravity. Then, para mas dali at tumasis sa itong patient. Then, pulls the patient against the self. Slides patient down to the leg to the floor. Does not risk personal injury. Then, bend knees, lower the body with patient. Stays with patient until help arrives. So, assuming that our patient is about to fall, so always with care jud nga to ang pag-handle sa tong patient. So, pinang klase yung ma-follow ka ha. Then, ang kamot sa gait belt. Then, both feet apart. Then, Anak. Then, nainay. Red light. Then, Pilo ang ni para support. Then ipasandig nga to ang patient sa ato ang left leg or right leg. So kung sa man ang position, then we wait for the help to arrive. Then stay with patient till helps arrive. Then return the patient to comfortable position in bed, chair, perform stand hygiene. So karon magulit na ta sa help. So help, palihog ko sa chair, nurse. So sabay, i-guide ko sa iya sir. Dire na gumit sa gate belt. Okay, 1, 2, 3. Diya to si transport sa yung bed sir. Na kung wheelchair ni. Sige sabay lang. Then, return the patient comfortable position in bed. So sir, balik ko sa mong bed sir ha. 1, 2, 3. Then, higda na po ta sir. Natong leg sir. Then, after comfortable mo ba sir no? Wala kay pain na nabatian or any discomfort sir?
Wala.
Wala. Then, next is to perform hand hygiene. This is to deter the spread of microorganisms. The next is to record time and distance ambulated, changes in vitals and patient's tolerance in the patient's chart. So, the rationale for this is that we can document the progress of our patient during his daily exercise or daily ambulation. So because of the para makabalo atong doctor and other staff if successful ba ang ambulation sa atong patient, and if dili siya successful, it means na need na po nato other na solution para atong patient is successful nandun sa makabaktas siya og tarong. Then after that is we take the vital signs of patient and record again in the patient's chart. Thank you.